Good afternoon, everyone. Well, it's been another good week in the state of Missouri. On Tuesday, we traveled to the University of Central Missouri's Innovation Campus in Lee Summit and met with the Northland Education and Business Alliance. We also traveled to Chillicothe for a broadband announcement at Green Hills Communication. And it's great to be talking about infrastructure and workforce development again. Some of the innovation centers we went to up there, I just think over the last year, everything we've been through with COVID-19, but all the things we put in place prior to that pandemic on workforce development, how much that's paying off today as we're trying to recover from a pandemic, and what those institutions and what those cities are doing to make sure we continue training people for the workforce of tomorrow. And it goes back to what I said a couple weeks ago. It's why it's so important that we were able to continue with the economic development during some of our toughest times by creating 10,000 new jobs in this state and over $1 billion worth of infrastructure improvements in our state, and simply to be able to stay the course for the last 2.5 years. The other thing I want to say is I had the opportunity to be in St. Louis today in the St. Louis region. We went to the Pfizer facility up there and couldn't be more proud to have that facility here in Missouri. As I went through there and talked to some of the science and some of the professors that are in there, just to see the everyday workers up there, what they've done and what they've been through for the last 12 months, about staying the course. Many of them talking about working through weekends, about working long weeks, like all of us on the front line seems we have been. And then to think here in Missouri, every Pfizer vaccine in the world, Missouri has a piece of that vaccine that's saving lives all across the world. And it all happened right here in Chesterfield, Missouri for that with Pfizer. And I appreciate the team, Dr. Smith and her team up there, for giving me the opportunity to go to the facility and understand a little bit more about why vaccines were so important and how they were able to do it at a faster pace than normal under the circumstances on that. I also made a stop down at with the Urban League in St. Louis, where we went and visited one of the targeted vaccine sites that the National Guard was doing. We had teamed up with the Urban League. That's been going on now for almost a month in St. Louis, and these teams are being very target specific, where we can take them into smaller areas, we can take them into community centers, senior citizens centers, and be able to administer that vaccine. And from there, I met with some people at BJC up there to see how things were going, to make sure and tell them thanks for what they've been doing, considering the footprint they have in the St. Louis region. But I will tell you, every stop I had today was positive stops. Everybody knew the situation the state of Missouri was in. They were thankful for what portions they were getting, and were anxious to get more vaccine in the future on that. So let me say this to start things off. We've had a couple of good budget items to share. Earlier this week, we approved $10 million in CARES Act funding for rural hospitals and $2.5 million in coronavirus emergency supplement funding for emergency medical services at mass vaccine locations. And yesterday, Missouri's monthly general revenue report showed that net general revenue collections for February increased 8.1% compared to last year. Thanks to our balanced approach, Missouri's economy continues to come back strong, and we are very optimistic about the coming weeks and months. On the COVID-19 front, virus activity in Missouri has declined for the 7th consecutive week. Our 7-day positivity rate is now down to 4.5%, and Missouri is still second lowest in the United States of America for average daily cases. Hospitalizations also continue to decline, falling below 1,000 for the first time since September. On February the 28th, Missouri hospitals reported 989 hospitalized patients, a 64% decrease since the first week of January. This is great news for Missouri, and we believe these numbers will only continue to improve as more and more Missourians get vaccinated. We also continue to get great news on the vaccine front. As you know, Johnson & Johnson vaccine was approved last weekend, and we expect to receive approximately 50,000 doses this week. Of these 50,000 doses, 5,000 will be distributed to targeted vaccination sites in St. Louis and Kansas City, and 10,000 will go to regional mass vaccination events. The remaining 35,000 will be distributed to other providers across the state. This will allow local providers to determine the most appropriate use for a single-dose option in their communities. With vaccine supply continuing to increase and more Missourians becoming eligible, we will be adding an additional delivery channel to help increase vaccine accessibility. Starting next week, 15% of our weekly state allocation will be distributed to selected pharmacies across the state. 161 pharmacies have been identified in 84 counties and were selected based on ability, location, and population. We are working to identify even more pharmacies specifically targeted vulnerable populations and counties that are not yet represented. While vaccine distribution is based on population throughout each region, we do recognize that some Missourians are less interested in receiving a vaccine than others. Vaccine interest is often highest in the urban populations. So starting next week, we will begin transitioning mass vaccination teams to accommodate more events in Region A, which is the Kansas City region, and Region C in the St. Louis region. We expect a full transition by April the 1st. Eventually, 2 teams will be operational in Region A, and 3 teams will be operational in Region C. Both mass and targeted vaccination events hosted by the state will begin utilizing the Johnson & Johnson vaccine as supplies allows. This will help increase the scale and efficiency of these events, as vaccination teams will not need to return for boosters. Just as we have done all along throughout this pandemic, we continue looking to what is next and taking proactive steps now to be ready for the next phase of this fight. There is no doubt that there is still more work to be done, but we are absolutely making progress and seeing results. I assure you that we will continue to take a balanced approach. We will fight COVID-19 and give every Missourian who wants a vaccine the opportunity to get one. Thank you, and God bless. Dr. Williams?
Thank you, Governor. The governor was in St. Louis this morning, so I thought I would go with the Royals. I'll be there Saturday helping vaccinate at Swope. Can't thank Rex Archer and the FQHC there enough for making that happen. Senator Washington also was very pivotal, and Joe Palm, our head of Minority Health. So looking forward to being in Kansas City Saturday morning. To echo the governor's comments, it's been a big week. We worked all weekend. I had an interview. Robert Nodell and I were interviewed for an hour by a reporter this week, and one of her questions was, she said, I just get the sense that your team works really hard. And I really appreciated her sensitivity to that, because our team really does work very, very hard. Many days working through the weekend like we did this weekend to make sure that the Johnson & Johnson got out as quickly as we can. So on behalf of our 1,800 employees at DHSS and the 55,000 state employees, I just hope, and I think most people in Missouri know, just how hard we have been working to make a very dynamic process happen. I was on a phone call yesterday with our congressional delegation, all of them, briefing them on the background in Missouri, and very much appreciated that opportunity. Had the opportunity this week also to talk to the new CDC director, Dr. Walensky. And just want to reiterate the message that when we are second in the country for the fewest cases per 100,000, when you look, you got to remember a year ago on Saturday, the governor and I were in St. Louis with Sam Page and Spring Schmidt for our very first case, March 7th, 2020. That was a year ago on Saturday. And we were all there. And now we are second, and we're very appreciative of that. But when we say that, to echo Dr. Walensky's comments, we don't say that to brag. We say keep on doing what we've been doing. That's what has gotten us here is a spirit of cooperation and working together and people doing what we ask them to do. So we say that to say keep it up. This is not the time to relax or to stop. So with that, I'm happy to take any questions, Kellen. Hey, Jack.
I have two questions.
Sure.
Why do you think the cases have dropped so much since November? And second, why isn't the state tracking where people in any given county are actually receiving their vaccines?
The second one, we have access to that data to know where people kind of migrate to get vaccines. And so I don't know that it's forward-facing, but we do have that, and we can talk about sharing that. But we can see when people go from St. Louis to other places or people go to St. Louis to get that. So we know that. The first question I really appreciate, Jack, because I do think people, at one point will say, what did Missouri do? For the 8 states around us, I think the closest state to us is Illinois, which is 15th, and we're second. The state that's ahead of us is Hawaii, which is kind of a different universe. Jack, I think there are a couple things. One, clearly, I think that you have an aspect of seasonality, that if you look across the country, you're seeing that numbers are going down. So that wouldn't explain why Missouri is distinctive, but it would explain that. We certainly think you have some component of people who've already had the disease, what you would call limited herd immunity, probably 1 million Missourians or so. Vaccinations are helping. We already see that anecdotally in our hospitals where they have much less absenteeism from work. But at the end of the day, all those things I said would probably be true for every state in the country. So you're left with, well, why is Missouri different? And I truly believe that history will show that a balanced approach, that Missourians about November really heeded our request to do those things that we asked them to do. And I really think that that's what makes Missouri different. I really do. But thank you. It's a very thoughtful question.
Dr. Williams, by transitioning the 15% to vaccine desert mitigation as well as increasing the mass vaccination events in urban areas, are you guys saying that hospitals may not have been the most efficient method to distribute to urban areas?
No, not at all. Again, if you remember in the very beginning, we did hospitals because it was Pfizer vaccine. It had to be stored at 94 degrees below zero, and now it doesn't. So that was the theory then. And then we tried to broaden it as we got more vaccine. But I would just tell you that almost every decision we make about distribution is based on allocation. The more vaccine we get, the more options we have to distribute it. And you just heard the governor announce. We have a new one, which is our pharmacies in these small areas, and can't thank the Pharmacy Association enough. So when we broaden it, it's not an indictment of anything that anybody's been doing. I just got off a phone call with the Missouri Hospital Association and couldn't be any more thankful for Rich and Herb. The governor was just there. And if you've been to any of these things at the University of Missouri or Truman or like the governor was just at BJC and seen them, you could have just nothing but appreciation for our high throughput centers, the people there. I marvel at their ability to vaccinate 2,100 people in a day. So please don't mistake that for great appreciation. But we really think, we know that next week we're going to get not as much Johnson & Johnson. The government's been very forthright about that. We won't get as much next week. But I'll anticipate this question, and I just got asked it by the Missouri Hospital Association. We certainly think in the beginning of April, so that's about 3 weeks away, we're going to see a marked increase in the amount of vaccination coming into Missouri. And so the governor wanted us to ramp up for 2 weeks for the 15th, but we're asking people to ramp up again after that for around April 1st. Dr. Walensky said it, Tony Fauci said it, the president has said it, that in the months of April and May, we think we're going to have a very large amount of vaccine.
Going off of that about the Johnson & Johnson vaccine, is there a time frame on when we'll get more doses? And if it is going to be a few weeks, is that going to affect the rollout of vaccinating Tier 3?
No, we don't think so. I think we know next week we're going to get a decreased amount. I think the next week we'll get more, excuse me, but by the last week of March and certainly the first week of April, our understanding is that the Johnson & Johnson will significantly ramp up that first week of April. So, and again, some of you have asked this question, I've seen it. We've always known going from tier to tier is not a cliff, it's a hill. And so, what the governor made very clear to us was he just never wanted to be in a situation because of our not moving on and giving people time that we had people who, that we had more vaccine than people were eligible for. So we always try to steer it to the side to make sure that there are always people out there eligible to get shots in arms.
We'll take 2 more questions.
Okay.
Dr. Williams, it has to do with the next tier that is becoming open in just over a week. Obviously, we've been vaccinating people that are over 65, healthcare workers, and you know that they're 65 when they might show their ID because they're 65.
Right.
We're moving into a tier where you're going to have all different age groups that fall under this, for teachers, people that work in communications. How is the state going to keep those people, reliable, or how are you guys going to know who it is and not people jumping the line and get vaccinated because they know more people can now?
Well, we're already there. We have 1 million Missourians under 65 that qualify for conditions, heart disease, cancer, pregnancy. So we're already there. So when they sign up to get their vaccine, they attest to where they fit in. So we go on an attestation. So it's an honor system. But I have great faith. The vast majority of Missourians are doing the right thing. I can't tell you they're not going to be people, that's just human nature, who are not going to do what you ask. But I just don't see that being a huge problem. I think to our great credit, Missourians, I think, have a fundamental sense of doing the right thing when it comes to this type of thing. But we've already been dealing with it because for 1 million people, if you come in and you say heart disease, we don't ask for a letter from your doctor or anything. So thank you.
Hi, Dr. Williams.
Hey, Jessica.
How are you?
I'm well. I hope you are.
Thank you. I am doing well. So I know you've touched upon this before, but this week we're seeing President Biden really kind of push states to vaccinate teachers and make them a priority. So as we enter this next phase, are they going to be at the top of that priority list for Tier 3?
Jessica, thank you very much for the question because there has been a little bit of confusion about that. It's going to be a little bit of a long answer. President Biden said that if you're in one of the 9,000 pharmacies that get vaccine directly from the federal government, that it was his expectation that they immediately vaccinate teachers as of yesterday. We had a conversation with the CDC in the White House about 2 weeks ago in which we had hoped that the prioritization of states would be kind of respected because you can imagine it creates a little bit of a confusion. But be what it may, they decided not to do that for the first time. That's the first time that's happened on Wednesday. And we've talked about it, and I really appreciate the governor's guidance on this, is that when it comes to these vaccines, everybody who's been tiered is eligible, okay? So nobody takes precedence over anybody once you've been made eligible. So 1A, 1B, Tier 1, Tier 2, when we get to Tier 3, everybody's equally eligible. However, whether it's giving the Johnson & Johnson vaccine or in your local community, you're allowed to make a decision who you're going to vaccinate and what kind of cadence. So let me give you an example. It's perfectly okay for a local health department or a local hospital to work out an arrangement with a group to say, on this day, we're going to use a fourth of our vaccine to vaccinate teachers. They're all eligible. They can do that. But we are sticking with our tiers for teachers and food workers and agriculture to the 15th to give everybody a chance to ramp up to an article in the St. Louis Post-Dispatch this morning about trying to do everything we can to get those people who are still over 65 and with health conditions vaccinated, to try to get as many of them before the 15th, and then we'll move into those. But thank you for the question, because I've just got that, and I've actually gotten that a lot, and I hope I clarified that for you. Thanks, Kelly.
Governor Parson?
You know, well, before we get started, I'm not sure who asked the question. It was over here somewhere. They asked Dr. Williams about how we're going to check if a 30-year-old or somebody jumps in front of the line of the next group. I'm not sure who did that. But let me just say this. I'll tell you, I think Missourians are better than that. I don't think healthy 30, 40-year-old people are going to jump in front of seniors. The vast majority of the people in this state won't do that. And I have to trust them to do the right thing. And I think the vast majority of them will do exactly that. I don't think they're going to jump in front of their dad and moms. I don't think they're going to jump in front of their grandparents just because they got to go have a vaccine. There is no way we can make sure that somebody don't fraudulently do something, or somebody doesn't lie, or somebody says they don't have a health condition. But the vast majority of Missourians to this point are doing it right, are being respectful for one another to do it. And I assume that will continue on in this next phase. Not to say some won't take advantage of it, but the vast majority of Missourians will do it right. Kelly?
Hey, Governor. Given the state's current fiscal situation, you just talked about it a little bit earlier, are you surprised that at this point, a year after you and a lot of other people thought there was going to be a real big problem with the state budget, that we're in this position? And if there is indeed, quote, extra money or federal money, where would you like that to go?
Yeah, well, multiple questions there. Would you, last year when this all started up, March, when none of us knew what direction this was going to go, maybe more in May and June, I would have thought a little bit more cloudy scenario in June is why we did the withholds and everything. We didn't know where the state was going to be a year from now. We always thought in the fourth quarter we'd have a better idea where we are, and fortunately for us, that come true to be a good fourth quarter, and we were able to continue businesses and continue on the workforce development. You heard me more. I think the one thing you still got to remember, there was 2 income tax years in the same year. So to say you're flush with money, I'm not sure you're going to hear me say that. But the point of it is you still got 2 combinations together in 1 year. So that's a little deceiving. Now, that said, 8.1 revenues being up is good news, because that means people are out there spending money. But I still think we got a ways to go, and I wouldn't say by any means we're flush, because I don't think we know what's going to happen the next couple of years down the road. Now, to answer your question, I would assume on the federal dollars you're talking about that's coming in. I would hope, and we've been in contact with some of our federal delegations and people in Washington, D.C., we would hope we would have the flexibility to utilize that, especially for a state like ours that is in good financial state, that I feel like we did the right things during this last year, that we have the ability to invest that, hopefully in long-term projects for the people of the state of Missouri. What I don't want to do is, frankly, just get a lot of money just coming in the state from about a lot of money coming in at a very fast pace, and all of a sudden we're just trying to find ways to spend it. I don't want to see us get into that scenario. I think we really need to think this through. We need to think about long-term projects that we can invest in that will really make a difference. So we're not there at that point to see how that's going to come down and what kind of regulations are going to be on it. But my understanding is that we're going to have some leadway on it.
Governor, we heard this week that Texas and Mississippi have rescinded their statewide mask mandates. I know that Missouri does not have one, but I was curious how you would advise city and county level officials to proceed on that matter.
Well, I think you got to go back to the numbers. That's how this all started, by looking at the data. So if you go back and look at the data where we are today, the data is pretty positive. I'm not sure before we were at 5%, we had any very much regulations or anything. So I think that's a question we all got to answer. I think the quicker we can get businesses back open and people back in there to make a living is a good thing. I think if you're out there and you're in some of the areas that still have mandates, you should seriously take a real serious look of how you're going to do that. And here's why I say that, because I haven't done a mandate in the state. It's been quite publicized to that. just because government tells you we're not have a mask mandate, I still think many, many people will wear masks. I believe they'll take that upon themselves to do it. I've just never believed it's government's the one that's going to make you wear a mask or not.
As far as the National Guard events go, will we be seeing a lot of them prioritizing teachers in the future to vaccinate teachers through the National Guard events?
I think so. Well, let me just say this. I think what the National Guard, what we really want that set up to be is do what we would call a truly mass vaccine event. So when we say that, I want to be able to go in somewhere, whether that, and more than likely that's Kansas City or St. Louis region just because of population, and we can do 6,000 doses a day and maybe have a 2-day event where you have all the way from 10,000 to 12,000 people vaccinated in a couple of days, where you go in there and you set up, you stay, and the same thing in the St. Louis region. That's how I foresee the National Guard's best use. Now, I will say, however, I will say by putting these targeted vaccinators in from the National Guard where we can move in a little tougher places like we were in St. Louis today, that we can take them in there in 4-person units, and you can go in there and target 160 people at a senior center, at a nursing, or not nursing homes, but other centers up there that would have housing projects where we can go in there. It's a little harder to take a full mobilized large vaccine. So we aim to use the National Guard. But let me finish by saying this. We, the state, want to get out of the vaccine business. I mean, we're here to support the local levels and try what we can to do is get as much vaccine in people's arms. We eventually want to be able to keep expanding to the pharmacies, to the local levels where the National Guard is not part of the vaccine process. So that is our goal, to get there. And the sooner we do that, I think the better it is for everyone.
The House passed its unemployment forgiveness package this morning. What are your thoughts on the effort and its progress through the legislature?
I didn't hear the first part of it on that.
The House passed its unemployment overpayment forgiveness package this morning.
Right.
What are your thoughts on the effort and its progress through the legislature?
Yeah, I haven't read what they passed, but I think the same answer I've said before. We're open to see what the legislators do on the unemployment issue and to see where that comes. I mean, look, the one thing I said from the beginning, and I'll say it again, you know, I don't feel comfortable doing a blanket policy for everyone in that arena. There's 42,000 or whatever that number is, you know, just to be able to go out there and say, okay, everybody gets to walk, because I don't know what was right, what was wrong. We don't want to punish law-abiding citizens. We don't want to do this. Somebody made a mistake. I get that. And I think the legislator, we've talked to them. I think they understand my concerns of just saying we're going to give a blanket policy for everyone. But I'm more than happy to see what that process works. We'll take a look at it.
We've got time for a couple more, Governor.
Okay.
Hi. Just to kind of follow up on that question about the overpayments, if that does come back from the Senate and includes the state's portion of the unemployment compensation, would you support that?
Well, again, I've always been really reluctant to say what I would support, and what I'm trying to say is if they come back what I believe to be a sensible approach to how we can deal with it, you know, I'm open to looking at anything. What I would sign is what I'd be hesitant to ask until I see what it is till it hits my desk. But I think by that time we're going to know kind of what the end result of that is as it goes through the Senate and what else they put in there. I don't know what all they'll put in these, and you all know here in February and March, things are going to look a lot different the last of April and first part of May. So we'll see when we get there.
You've said repeatedly that there is no divide between urban and rural Missouri as far as vaccine distribution goes, but your state's own consultants have found that the biggest vaccine distribution gaps exist in the big cities. Can you explain the discrepancy there?
Yeah, I mean, population's going to tell you that, and how big the St. Louis city is versus how county or rural county areas are. There's going to be desert spots, what we call deserts, in all of them. It doesn't change. It doesn't change the amount of vaccine they're getting per population. You can twist numbers however you want to and say them however you want. At the end of the day, that region is getting the same amount of vaccine. Matter of fact, as of this week, the 37% in that region, Region C. St. Louis City and St. Louis County will get 68% of that. And now how that gets distributed once it gets up there, that's more up to the local level. So if it's not getting to a certain area, then we need to either figure out what we're doing with the National Guard to help with that situation, or the local entities need to make sure they're getting to areas where it's not. But the percentage is the same.
So even within the region, the percentages are even within like counties across one region, is what you're saying?
Yeah, I mean, well, it's going to be distributed, however they decide to distribute it and wherever we put it up there. So if you want to refer to like, let's just take Jefferson County. I think that's what you're trying to say there. Are they getting more or less than another county? Is that the question you're asking, and how that's distributed?
Yeah, like within the region, like each region gets their proportional amount, but with, you know, the regions have like 10, 13 counties in them. Are all of those areas within Region A or Region C, say, getting their proportionate amounts?
Yeah, I'm not sure I'm following what you're saying. Here's what I'm going to tell you. Whatever region it is, pick the letter. You're going to get the same amount of vaccine per your population, no matter where you're at. You're going to get it in that region. How it's distributed in that region could change, fluctuate from county to county. I think if we have a mass vaccine event in Jefferson County or Franklin County or St. Charles or St. Louis County, if we have one in that one day, that number will change because you're literally going in there, you're doing 2,000 people. So if you want to see what that number is the day after we do that, it'll be distorted to the whole area when you do that. Again, you just got to look at the whole number we're doing to each one of these zones. That hasn't changed since October. It's not going to change tomorrow. We're going to stay on schedule to this vaccine the way we've done it from the beginning. We're going to open up this as soon as we can, such as March the 15th. And then that next phase, hopefully we're going to be able to announce that shortly after that when we can open that up. But we're going to stay consistent. That people need to hear that. People need to know that and know what we're doing on that. So, all right. Thank you.
What are you going to do to make sure that it doesn't happen like Putnam County again?
All right, so we've got a press release